So again, welcome to everyone. My name is Katie Leopard. I'm the Director of External Affairs at Choices, the Memphis Center for Reproductive Health. And again, as I said, we are doing a webinar series this year at Choices on different topics of interest to the community. And our topic today is breastfeeding and chest feeding. So questions and answers. So I'll introduce our panelists first. We have Dr. Allison Stiles, who is a graduate of Central High School here in Memphis. Go Warriors. She studied biochemical engineering at the University of Missouri and attended med school at the University of Cincinnati. Allison is a med-ped, which takes internal medicine and pediatrics, which are both 3-year programs, and combines it into one. So she has a family practice here in Midtown on East Moreland. She's actually my doctor, so. She is a mother of 2 very active children who she breastfed exclusively for 6 months, even while she was back at work. So it can be done. She loves newborns and helping new parents with breastfeeding and the challenges of that first month. And being a med peds doc comes in handy there because she is able to help parents with issues like postpartum depression, breastfeeding, and other things. Allison became a consultant for the Tennessee Breastfeeding Hotline in 2015 and became a board certified lactation consultant in 2016. So welcome, Dr. Stiles. Thank you so much for joining us.
Thank you.
Allison, I'm just going to introduce the whole panel and then we'll come back to you for your introduction of yourself. So our other panelist is Tiana Pyles. And Tiana started Breastfeeding Sisters That Are Receiving Support, so BSTARS, to help Black families reach their breastfeeding goals in Memphis, Tennessee. And she launched BSTARS and really was trying to provide a safe space for Black women and for women of color and their families to receive breastfeeding education and support. So she is the president and CEO of BSTARS, and began as some of her advocacy efforts as a breastfeeding peer counselor in Northampton, Massachusetts, before she moved to Memphis. And we are very happy that she did move down here to help us out in Shelby County, where she worked at the Shelby County Health Department, and also as a breastfeeding peer counselor since 2014. And she became very active at that time as well in the Shelby County Breastfeeding Coalition. So she's an active member there as well. So we're very excited to have Tiana. She is now, from its conception, BSTARS has maintained a partnership with the Shelby County Breastfeeding Coalition. And they have just recently become incorporated and have received their status as a 501c3 organization. So I'm sure Tiana will help us know how to donate to that organization at some point in your talk. So our final panelist is Talita Oseguera, and she is a certified nurse midwife at Choices, Memphis Center for Reproductive Health. She is very active in reproductive justice as an advocate. She has a background in community-based healthcare centered on equity and the advancement of historically marginalized groups and the empowerment of women and partnerships with families. She's been a full spectrum doula since 2013 and has devoted her professional and academic career to both birth and research justice. Talita is committed to improving reproductive justice, honoring and amplifying the voices, experiences, and issues of Black women and individuals across the sexual and reproductive and perinatal continuum. She works alongside birth workers of color who reflect the communities they serve and works to improve care for and with Black women and individuals. Talita is one of our team of Black midwives that work at Choices Memphis Center for Reproductive Health and our new Health and Wellness Center, which just opened in September of 2020 at 1203 Poplar in the Medical District. So she's joining us from there. So I'll ask you each, probably in that order, Allison, if you'll go first, just to introduce yourself to the group, say more than what I just read of your bio, and talk about your work and the organization that you're involved with.
Well, thanks for that great introduction, probably more than I would have said anyway, but I guess, really through pediatrics, I became interested in breastfeeding. A typical course, I think, finding that it's so much harder than it seems, and there's so many challenges for us working moms in breastfeeding. And so, feeling like, gosh, I had pediatric training in breastfeeding and I still was inadequate. And so I guess that got me interested. And then, have been chair of the Shelby County Breastfeeding Coalition, which is really our local kind of lactivism group. We're trying to work across the whole spectrum of what needs to be done, from the birth hospital, to the support after discharge and, the lactation, support and so forth. So, doing the whole deal. And just to say, we have a website with our resource guide, which is a really great place to find local resources. So there are even lactation consultants who come out to the home who do house calls. There are counselors who do house calls. So this resource guide on the website has got a lot of good folks on it, including me. And then the Facebook group, though, is really, I'd say, the best place to get, minute to minute information, because we can post stuff much more easily, events and what's going on in the world of breastfeeding. And we have folks like Tiana who are plugged in to the different lactation consultant groups, like, the US LCA and the USBC, and these are folks who are making policy, and I'm really more plugged into the medical side of it. So that's the Academy of Breastfeeding Medicine, who lays out all protocols for breastfeeding. So, that's a very good resource too for folks wanting to know what's the protocol for my preterm infant, discharge planning and so forth. But anyway, just those are some of the resources that we have, and I'm glad to be here. Thanks.
Allison, tell us the address of the website and the name of the Facebook group, if you will.
It's the Facebook group is Shelby County Breastfeeding Coalition, and the website is Shelby County Breastfeeding.org. Yes.
Okay. Awesome. Thank you. All right, Tiana, can you do the same? Introduce and tell us about your organization and your work.
First, thank you, Katie, for this opportunity to join you all today. It's amazing that we were granted as BSTARS with Nakia access as you all were finishing construction on your building. So congratulations. And it's just amazing just the amount of time that's going by. But in that, it allows such great connections and networking opportunities, including us here to gather together. My name is Tiana Pyles. I'm a co-founder of BSTARS. BSTARS is truly a community organization, and I do my best to facilitate some of that energy. We are organization-led in terms of the support we try to give the community for Black women and their families. And we've been going strong since 2015. And for my breastfeeding journey, I'm a mother of 4. I come from an unbroken line of breastfeeding mothers. And so me growing up in Northampton, Massachusetts, in the Valley, a earthy, crunchy kind of place, and a breastfeeding family, it was expected that I was going to breastfeed, although sometimes you find, as a young mother, you're going to be a little rebellious and you're like, I could do this better. It's like, no, I guess I can't. Okay, I'm going to breastfeed. And had that support and that I needed, and we had a great start. I breastfed all 4 of my children till they were 3, and when I moved to Memphis to take care of both of my grandmothers in their later years of life, they were the generation that did not want to go to the nursing home, and brought all of my family here with me. It was a culture shock. More Black people than I was used to seeing. Then I'm not like, it's like, whoa. And then coming to find that a lot of our Black families are not breastfeeding. And some of it for the simplest of reasons. Now, of course, there are other complications that can be involved, but just lack of support and education. And so I've been a peer counselor since my oldest was 1. For 23 years now. And moving here, even though I was in real estate when I first moved here, once a peer counselor, always a peer counselor. So, just watching trends and then watching the Shelby County Breastfeeding Coalition and what they were doing to support the Shelby County Health Department finally getting their peer counselor program. I was excited to join and do whatever I could to help promote for my sisters, our family, my nieces and nephews. This is personal to me. And so, as it is for a lot of us in this work. And so, just trying to do my part in this work. And so my work here locally in Memphis led me to help the state coalition to revamp the Tennessee Breastfeeding Coalition. And then now I am chair-elect for the United States Breastfeeding Committee. So,
Awesome.
no pressure, right?
No.
So just hoping to continue these networking opportunities that we have here on the ground floor to influence policies across the country in terms of the support that all of our families need for breastfeeding education support.
Awesome. Thank you so much, Tiana. Thank you for all of your hard work and for your time today. Talita, tell us about yourself and your work.
Good afternoon, everybody. My name is Talita Oseguera. I am a midwife here at Choices. I am a parent of one very spirited 11-year-old who I breastfed for a little over 16 months when she decided to self-wean, and then a couple months later wanted it back, but it was nowhere to be found. My lactation journey actually was a pretty rough at the start. I birthed at a hospital, and while my birth was just fine, the support I received postpartum immediately, especially with breastfeeding, was truly lacking, and I would say harmful and actually even traumatic. I returned home and had what I call latching issues for a solid 3 weeks, where I was expressing and feeding her with a syringe. So all of those struggles, I would say, kind of, led me to this journey of having, a commitment, because I did have support, with my family and friends and some people I knew that were doulas. And so I became a breastfeeding peer counselor before I went to midwifery school. So shout out to you, Miss Pyles. I just really enjoy joining people, meeting the families where they are, starting on this journey, and doing what I can to, support them as much as possible. I'm also on the journey to becoming an IBCLC someday. But yeah, so Choices, Katie mentioned this, is a full spectrum comprehensive reproductive and sexual healthcare clinic located here in Memphis, Tennessee. I moved about a little over a year ago from Oakland, California. Our high quality, affirming healthcare services are available to everyone who walk through the doors. We offer abortion services, family planning, also known as birth control options, wellness care, including physical exams, labs, sexually transmitted infection testing, LGBTQI services, affirming care through hormone therapy. And we're also providing midwifery care in terms of prenatal care, birth in all the locations, home, hospital, and Memphis's first freestanding birth center. And then our midwifery team specifically in terms of postpartum support with breastfeeding in person looks like several touch points postpartum through the many weeks up to 6 weeks. Specifically related to breastfeeding and human lactation are we have full 1-hour appointments for prenatal care. So on top of the physical aspects of prenatal care, we also provide childbirth education, emotional support, guidance, assessment in terms of people's infant feeding plans, breastfeeding education, just before people's the arrival for their baby. So people are not making the decision to breastfeed or not after the baby is here. People make that pretty quickly after they, find out they've been pregnant and decide what their plan will be for the pregnancy. So I am just very honored to be in this space with all of you, Dr. Stiles, Miss Pyles, Katie, thank you for facilitating this for us. And I just want to, acknowledge that we're here for Black Breastfeeding Week. Remember that Black people have breastfed from the beginning, right? Shed light on some of our recent statistics, highlight the ever-present disparities and how we can really get to equity and justice around human lactation and breastfeeding. I'm excited for the questions that we're going to get from the group chat, and as well as deepening the relationships and the partnerships that we have here in Memphis. So thank you.
Awesome. Thank you so much, Talita. Thank you, everyone on the panel. Talita, while I'm going to pause just for a minute to also mention to everyone that we are recording this webinar. So it will be available to share. Watch Choices social media in the next week, and you'll get to see that we'll publish the recording, and then please share this to others. In that same vein, I want to say a quick thank you to Madison Webb, who is our development and outreach coordinator at Choices, who is behind the scenes working all the tech and making us look good for y'all. Thank you, Madison. So what I want to do first, and this was a great segue, Talita, is ask Tiana if you will share and speak a little bit about breastfeeding and chest feeding disparities statewide. What does Tennessee look like right now? What does Shelby County look like right now? Give us some stats.
Sure. Am I allowed to share my screen?
Absolutely.
Okay. I put my glasses on to get us to where we need to go. Okay. All right. So what I would like to do. All right. You all tell me if you can see that, and I'm going to put it in. So from the beginning, this is some stats that I shared with the coalition, and for our National Breastfeeding Month, I got there. So our Tennessee data. I wanted to start here at least to give us a little bit more statewide view of some of our rates. There's 4 slides I'm going to show quickly, and so the darker brown is our lower rates. And of course, you find that here we are in Shelby County, which of course is western and all the way to the left. We actually look like we're doing pretty good. It looks like we're doing good. Oh, okay. Continue the good work, right? And so this was a comparison of Tennessee and the U.S. This is right below where the U.S. stands. Okay, looks like we're doing a good job, and we're up and to the right as we want charts usually to be. However, in our disparities, that breakdown, when you start to look closer, that's where you see like, okay, us together, we look great. However, when we start to break this apart, then you can identify the disparities. So I shared this with you all to see the gray is non-Hispanic Black, the yellow is non-Hispanic White, the pink, if you will, is Hispanic or Latino, and then Tennessee's overall rate. So when you plug these colors into this with the Tennessee rates, you see the breakdown of not everybody is making that the mark. The mark, and the thing is, the mark isn't even, we're not at 100% breastfeeding. Not that we ever will. There are definitely circumstances in which formula is a needed thing or donor milk is a needed thing. However, making it as Tennessee looks, our Black population for 2020 is only 73%. Versus 83% for non-Hispanic White and 84% for Hispanic and Latino. So those are the things in which it's like, all right, we have to pull up everyone. We have to pull up our most vulnerable populations in order actually to help everybody. And so in taking these moments to do that, some people don't understand the necessity necessarily. But that's okay. We'll educate them along the way as we try to save ourselves, and for the allies who support us and try their best to support in working on these disparities, that it actually affects everyone as we get this together. There was one more thing I wanted to share. See themselves in everything. And so there is a connection, if you will, when you find folks of like-mindedness that are in the professions in which you need for any services. And so that, of course, includes lactation. And so in working through having more IBCLCs, come on with it, Talita, and, and everything else, it's important that we be able to connect with our families and have these. Sometimes there's a language that you don't have to work through when you say, help, I'm trying to bring this baby for her first Thanksgiving, and grandmama's trying to give her green liquor. Now, not everybody understands that. It's like, okay, we love our grandmamas, but sometimes they could be our worst supporters, for all kind of different things. And so it's like, all right, how can we work through this to make sure that you are empowered to not share your child with your family, but feel safe, so all these conversations like that. So that is all that I'm sharing with you. And so let's talk about this. Allison and I, as we were getting things together, Allison, we were talking about the ratio in terms of it's 1 to 4, the ratio in terms of white women to Black women.
Perinatal mortality.
Right. That's right. You're right. Perinatal mortality. And it's crazy because, Allison, you were talking about the biggest thing is like hypertension. And a lot of it has to do, right? Say again?
Hypertension and which leads to preeclampsia.
Right. And you were saying a lot of this has to do with plain old salt.
60%, yeah. 60% of African American women have some hypertension and preeclampsia.
Right.
The problem is that is preeclampsia. Well, I was surprised to find that even mild preeclampsia, which is just hypertension, is a reason for preterm delivery. So they induce at 37 weeks, no matter what. So there you go. We're off to a bad start, because these early babies breastfeed less. And of course, the pre-induction, is more likely to end in C-section. So that's just hypertension, not even preeclampsia. And so anyway, and the other big factor is that these preterm birth, is the number one reason for the infant mortality. I'm sorry. The number one cause of infant mortality in African American babies is preterm birth. And those are those NICU babies. So that preeclampsia, hypertension leads to this, preterm birth. They end up, they can end up in the NICU. That's when they most need breast milk. Those babies need that protection for sepsis and neck and anyway. So please,
even COVID right now.
Yes.
It's amazing. There's so many wonderful antibodies that are found in breast milk that that we don't even know about, that just are there. And so Allison, as you were talking about, preterm birth and all, I'm like, I thank God for Talita. Talita, look, I'm a fan. When you came to Choices and all that, she was talking about you. I was like, yes, thank God, because the kid needs some help. And so I have been watching you just work and move. And so it's so important for in that empowerment that we have midwives that are entrenched in this work, know what they're doing and like holding it down for the spectrum of birth and for our families. And so kudos to you, Talita. I'm so proud.
Thank you so much for that. I've been a super fan of yours from afar. Because I know that BSTARS, was in the building and doing support groups and education before COVID, and I was just so looking forward to getting right in there with you. And it was like, oh, we can't do that right now. So all of the creative ways that we've been able to connect, people to the support that they need in the building and outside of it, at the pediatrician offices with the breastfeeding peer counselors. We have the Shelby County Lactation Coalition resource sheet on our wood table. And so I think as much as we can continue to work together, even through this pandemic, and especially because of it. And just promoting, continuing to breastfeed with COVID, These antibodies you're talking about, we can clearly see, side by side, a pumped bag COVID, no COVID, like what it looks like just with the eyeballs, right? Not even under the microscope yet, and just the level of antibodies. And I think if we can keep getting that education out, to people, yeah, I mean, this is a public health issue, right? Human lactation,
Absolutely.
breastfeeding. It's a solution to so many different things. Yes, it's free, and also there's just amazing, right, outcomes that we can see just from this first.
And like a big part of that is like just truly just education.
Yeah.
As we help our families, like there's nothing like you were Talita, like you were saying, when you're helping your families, you are trying your best to make sure that they're not making these choices of how they're going to feed their child as they're giving birth, And so because that's like, it's like, what you're hitting me with that now, and I tell my families, I'm like, this is like a wedding. You plan out your wedding. You want your day to go as best as you want. There's certain things we should not feel like we're delivering up our bodies to healthcare for them to deliver our children. You have to take ownership of this, and things don't always go the way we plan it, but we start with a plan. And in all of the with us and this community support, as long as we're talking the same language to our families in that handoff from Dr. Stiles to us in the community work, and and to you, Talita, with midwifery, and me in the community, they're hearing the same language, which is so important, because sometimes we don't, or not all of our families are hearing the same language. And so for us being intentional in this, we're trying our best to make sure that any family and how they want to breastfeed, that we get them the support that they need so that they can be successful in feeding their child.
Right.
So some of that is what we are hoping to cover in this webinar, like how do we help people be successful and what are the resources? So Dr. Stiles, I wonder if you would talk for a minute, because so you and Tiana were just kind of talking about that, those premature births and kind of that, even that first moment, you're almost starting off behind the curve, So Allison, can you talk a minute about how to have a relationship with your OB, your OBGYN, your midwife, whoever's, about setting yourself up for success. And then maybe even a little bit about working with your pediatrician about sort of continuing down that path of planning how to be successful, like we were just talking about, in terms of working with other physicians.
Yes, I think, you want to start off, you want to kind of know or find a breastfeeding friendly, OB and pediatrician. So what does that look like? And it's tricky. I mean, you don't have time really to interview your doctors, and if they even would allow you to have an interview. So it's mostly word of mouth, I guess, and Facebook and so forth. First of all, I would say can you find out their induction and their C-section rates? I mean, I think that says a lot. Induction is not a normal process. And I think it has become normalized. In fact, a couple of years ago, OBs were scheduling induction dates at their person's first visit, which is just ridiculous. It's hard to say, but your OB needs to be patient and allow you to labor and to give you appropriate advice. And, the goal being to get to full term, which is 40 weeks, and not be induced. So anyway, and just to say, I want to shout out to, midwives and birth doulas really do a great job of supporting the dyad, that mother and baby, and that means helping them through that breastfeeding process. Their breastfeeding rates are great and are really important part of the system. And you know what, too, they help us navigate the medical system. That's really difficult. I mean, I think as a patient, you're kind of thrown into this. You're told that your life is in danger. You have to, whatever. And it's true. You have to go down that road. But I think that along the way, birth doulas and midwives can help to navigate that process, to answer questions. So how do you find a baby-friendly physician? It's tough, but you ask the questions, you question things along the way, and you try to get information. For pediatricians, some of the key, things that affect breastfeeding are what happens in the hospital. So is your pediatrician going to be the one in charge in the hospital? How do they handle low blood sugar? So that's one of the first things that tends to come up. Do they know about the glucose gel, option? Will they let you hand express colostrum and use that? Could you bring your own colostrum? So, something that's rarely done here in Memphis, but it can be done, is that moms can bring their own hand express colostrum, or even a friend's, breast milk donor, or even shared, breast milk. And then if the pediatrician has to order formula, how much do they give? 5 milliliters is the appropriate amount for day one. And then an even bigger question is, how does the pediatrician handle poor weight gain? They should never tell a patient to stop nursing. If there's a problem with weight gain, generally the patient can nurse. They can then supplement if they have to, and pump, and pump breast milk, use the breast milk when they have that. So anyway, just some key, questions they can ask. I guess another, good one or easy one is, when do they have their baby follow up after, they get out of the hospital? It's supposed to be 2 to 4 days after they get out, after discharge. And the old way was 2 weeks. So if they say 2 weeks, but just anyway, those are some basic questions. But these early decisions have huge impacts on, breastfeeding, and there are these better ways of handling them. So, and just so, everyone knows who's listening, there are these protocols on the Academy of Breastfeeding Medicine's Facebook, or not Facebook, but on their website, and they are very lengthy and descriptive, and, how to handle low blood sugar, how to handle the preterm, baby, how to discharge the NICU graduate. So there's a lot of good stuff on there. And us pediatricians should know and should, look this stuff up and learn this stuff, all of us. But it's just tough. You don't get this kind of training in medical school and in pediatrician school.
I like the idea of interviewing your pediatrician, Allison. That's a great idea. And if your pediatrician or potential pediatrician won't do that, then that's probably a sign that's not the right pediatrician for you.
That's true. Yeah. But it's tough because you're in a big group, there's these giant groups, Peds East and so forth. They're great. And some of them have lactation consultants too. But that pediatrician that is your pediatrician, may not be the one giving the orders when you're in the hospital. And there's no telling. It's really difficult. Mm-hmm. And I believe firmly that all pediatricians should know some basics about breastfeeding, because you can't just hand it all off to the lactation person, in my opinion.
Yeah. So I wonder if any of our other panelists would like to address this question quickly, and then also want to encourage our attendees to put your questions in the chat. We do have some questions that we'll go to in a minute, but definitely if something's on your mind, put it in the chat. And Tiana and Talita, do either of you have any thoughts about that relationship with pediatrician or OB and how to make sure that gets off to a good start initially?
I guess one thing that came up for me while Dr. Stiles was talking was just the importance of knowing the policies or practices, the place that you're going to be giving birth. Let's say if you're a patient, I'm talking to patients right now. What Dr. Stiles is saying is so true. How does that hospital handle, most people are birthing at hospitals. How does that hospital handle low blood sugar or low temperature? Is their first thing to separate the baby from the person who just gave birth to them? Because a lot we can do is like put baby skin to skin, breastfeed the baby, give the baby that milk. Okay, we have colostrum, we can hand express it and give that colostrum on top of us latching. So, and if some of these things ahead of time, you may be able to be in a position to advocate in the way, that we need to as Black people who are showing up at a hospital. It's sad that that's how it has to be. And, having that knowledge can be really helpful and beneficial. And then for providers, if you have privileges at this hospital, privileges at this one, know what those practices are and how you can, advocate for your patients. Okay, we didn't plan on having a cesarean birth, but we're here. And okay, y'all don't do skin to skin, but we do. Like your choices is in the OR, and we are doing skin to skin, and that's okay. So I think there are some things that we can really partner with the, the providers are, if we're patients, and then whichever provider you're working with, hopefully they can know what the practices are, and then which pediatricians are in the community that do have, knowledge about human lactation and how to keep that going, and not to say, formula should be introduced now, because that's where my training is. So I guess that's what I would add. Thank you.
And these key questions, just to ask them, along the way, you may not, know what that hospital's policy is, but they can ask that question. And I think the doulas, maybe too, the birth doulas are there, to help the mom to ask the right questions, but also to help the mom through the labor process, because I have to say that I think, moms oftentimes don't realize that first stage of labor is usually 24 hours, and that what to expect, just to know what to expect, so they don't end up in the hospital, or end up in a C-section.
Mm-hmm. Yes, thank you. We have a comment from Rachel. Thank you, Rachel. And she says, I've found that many pediatricians don't know when to refer a patient to a lactation consultant. They just don't know how to recognize nursing issues. And so I think that goes back to Allison and to y'all both, all of you saying they're just not trained in those issues, but they should be. So.
Or maybe the lactation is hard to find. It, certainly
Sure.
practices have it, but
Sure.
in outlying communities, I don't know what there is. But lactation counselors are great too. Certified CLCs, certified lactation counselors, just a shout out. CLSs, certified lactation specialists. I mean, they're different training, lesser, a little lesser training, but they are awesome too, and they are more, perhaps more available. And folks are doing things by televisits now, and really that can work well.
Mm-hmm. So tell us, we have a question in the chat. What books, websites, and resources that pregnant women can start looking at now in order to prepare for breastfeeding and set themselves up for success? I know we had kind of talked about saving that question for last, but if anybody has any resources that are your favorites, let's go ahead and share those.
That's a tough one. I guess you're waiting on me, but
whoever.
Some of the classic books on, the Womanly Guide to Breastfeeding, and some of those are probably the best. But the other thing that's so great and maybe better now is YouTube. And, there are some great videos. I show a really awesome video in my breastfeeding class about that's a really great get started, video. What do you think, Tiana, in terms of resources?
A lot of, a lot of classics are still very good. Breastfeeding is usually breastfeeding. However, I find that, YouTube is helpful, but also just other support, other peer support, be it family or friends or trusted resource. Like there's nothing like it. Like when you were talking about, Talita, when you were talking about skin to skin after a C-section, like one of our members posted like soon after her C-section, still, like I knew she was going in, so I knew the time frame. So it was like, she posted this picture, she's laying with the sheet at her and her baby's breastfeeding as she's laying there. And I said, wait a minute. I'm like, are you still in the room? I'm like, oh, that's so great. And I'm so grateful that you shared, but can you let them do what they need to do for you? And we'll catch up later. But she was so, that was one of her biggest things. She knew she was gonna have a C-section and she wanted to still breastfeed. But the fact that she shared it in the moment was so powerful for other women to know it's possible. So just seeing it, to know it's possible is like a really huge thing, to be able to actually have someone else that you can refer for their story is very powerful.
Any resources of your favorites, Talita?
I'm finding a lot of patients and clients are really into social media, right? So like Instagram and Facebook and things like that. So, I really like Black Girls Breastfeeding Club. I like Legendary Milk. Loyal Lactation is also Black led. There are a few. There's a Facebook group on Friday nights, actually, in terms of community, but then resource support. It's called Midnight Milk Club. It's on Facebook. It's a Black space, and people are meeting, all over the country, and sharing resources and meeting, finding people that are right down the street from them and that they found on Facebook, through this group. So I think ways that we can connect people that way is, yeah.
Yes, can you post that midnight? That sounds great.
Yeah, it's called Midnight Milk Club.
I love them.
It's actually run by an IBCLC in Oakland, Tana for Lumaconda. So yeah, if people are interested in that group, it's on Fridays and it's a private group. So
that's very cool. And we have, thank you, Helen Scott has posted a couple of resources. KellyMom.com has good evidence-based, and LaLecheLeague.org and Women'sHealth.gov. So those are some other online resources. So I have a question. I'm a newish postpartum doula, and I'm not sure what I need to learn / know about breastfeeding and what I should leave up to the lactation consultants. She'd love to know what resources are good for professionals if they're different from ones for parents. Can anybody want to speak to that?
Well, just also want to invite you to my class. So I do a class on breastfeeding that's very comprehensive, or I think it is, on always the third Saturday of every month. And we've been doing it for years. And so that's an option. And of course, it's virtual now. The link is on Facebook. But that means that anyone can attend, really. So resources for professionals, if you mean like medical people, please check out the Academy of Breastfeeding Medicine, which is bfmed.org, and look at protocols. They're pretty in depth, but you can get some good top lines, from them. But those are great.
Thank you. And Helen has just shared also Tennessee Breastfeeding Hotline. So that telephone number is in the chat. Talita, I want to talk just a minute about issues around inclusiveness when we talk about breastfeeding and chest feeding, and I'm trying to get better about using both of those terms. But can you talk just a little bit about efforts to be more inclusive in how we talk about it and how we think about it?
Yes, I can. I actually do try to use a lot of interchangeable language. I think the general rule that I try to go to is to just meet the person where they are, right? To reflect the language the person is using. And I think that we can say breastfeeding. I think that's just fine. We may say breastfeeding and chest feeding and human lactation. I think if we can be as broad as possible and then reflect our language, with whatever language a person is using. I read a blog recently from a person who identified as non-binary and was going through a breastfeeding journey. And they were saying that they really did still appreciate the term breastfeeding, even though they, identify as non-binary, because they said, well, the breast tissue that people of any gender has is what's going to be able to produce milk. And so they felt like it was like, that's just a process of the human body. And I thought, oh, I love that. So sometimes everything, things don't have to be completely gendered all the time. But I think probably what I would say is it's just fine to use breastfeeding and chest feeding and human lactation. And we like to say infant feeding also, and ask people open-ended questions. How are you planning on feeding your baby? Instead of saying, are you going to breastfeed or bottle feed? Because if they say bottle feed, then you still want to ask, like, does that mean pumped milk? Does that mean human milk? Like, just saying breast or bottle is actually not going to get you to, the answer you need, and also the support that the person may be, interested in. So I think that's probably, what I would say to the inclusivity piece. The other thing is that I think in terms of like myths, sometimes people really worry about being able to produce enough milk for feeding their baby. And so sometimes that really is a biological, reason if a person has no known biological issue, there's a very low chance that the person would have issues, producing enough milk for their infant. But let's say they have had breast surgery, for instance, and that will definitely influence them. A person has to have, a mastectomy for a reason, like one side or both, breast reduction for some reason. So I think, inclusivity is also that, as well, in addition to gender and how people identify. And then the way that I think about breastfeeding is like giving body milk, right? So like pumping exclusively is breastfeeding, chest feeding, human lactating to me. And mixed feeding still counts, right? So if the person is giving some form of breast milk, body milk to their baby, like that is still so beneficial and should be celebrated in my mind. So that's my approach to inclusivity. I don't know if anybody else has something that they wanted to add on to that.
That's great.
I get it.
I don't know.
That's great. Thank you, Talita. Let's talk about some more myths. Tiana, do you want to talk about some of the things that you most commonly hear that are just misunderstood, or myths that people have about breastfeeding that get in the way sometimes?
Sometimes people feel that we've talked about in our journey today about colostrum. Colostrum is a lot thicker than breast milk. And so if a person does not know the importance of colostrum and how it is supposed to be thicky and not a lot, but so power packed, it's like an immunization shot for your child. It's their first immunization shot, because you don't know what you have birthed your baby into. And so it's your body of protection. And so if a mother knows that and realizes, okay, it's not supposed to be free flowing, it's not supposed to be like milk in a container, like all of those things, it has helped them to know what's going on. So myths about what breast milk looks like, the stages of it, public breastfeeding, oh, I don't want to flop my breast out, in public to feed my baby. And it's like, oh, but a lot of it is just conversation. We talked about children coming too soon, if not medically needed. I mean, there's this whole thing in Black culture where families want to see the baby. And so if you're going to have that baby induced and it's early or whatever, come on, we want to see that baby. And it's like, wait a minute, we need that baby to stay put as long as possible. They're getting all those good nutrients and everything they need for their journey here. And so then you can see the mom they're like, oh, yeah, you're right. Okay. So, there it is, just in a conversation, and the way things are said. In those myths, it's hard. The world we live in, just doesn't allow a mom to breastfeed and to live and work and do and be a person. So those are a lot of the myths in which with proper breastfeeding education and support from trusted people around them, and support that we can get through. And some of it can be hard, and there are challenges, and that's why there are truly lactation professionals. But as Dr. Stiles was saying, not everybody needs necessarily an IBCLC perhaps, or a doctor to let them know, girl, you got this. You can do this. So sometimes you just need that other circle of support and that community support to know it's possible.
Yeah.
Thank you.
This is a great question. If I could add a couple things, I liked what Talita said about, can I make enough milk? I mean, you got to remember that a mom can nurse twins and triplets and make enough milk. It's a supply and demand process. So if you need more, if you take more milk out, you make more milk. So really, you could breastfeed with just one breast. You don't have to have two. Or even, small breasted women make milk too. So it's all, it works out. But another one that I hear a lot is about eating right. I think a lot of moms worry because they don't eat well. They eat fast food and French fries perhaps, and they are concerned that their milk is going to not be right. That's a myth. Your milk is perfect and it's made. You don't have to drink milk to make milk, for example. If you think about countries where women are malnourished and starving and their children are thriving, and sometimes they're nursing an older and a younger child because that's all there is. They make milk that is perfect. So you don't have to eat right to make the right milk. And then, a lot of concern about medications. And this is another pediatrician thing. Most medications are fine for breastfeeding. And if you look in the resource, medication in mother's milk or mommy meds, which is, I think, maybe a free app, you can look your meds up and see that they are fine. But pediatricians should be the real resource for these meds, and, for looking them up and making sure you can breastfeed with meds. It's so much, there's so much more known than there used to be. Even having surgical procedures, you can breastfeed after surgical procedures. When you are, back to normal, your milk is okay. When you are okay, your milk is okay. And so anyway, just a lot of good, info about that.
That's it's so interesting. There are so many myths out there. One I think a lot of people deal with is, okay, how long do I have to breastfeed? How long is too long? How long is too short? So LaBrittany in the chat has said, how do you respond to pressure and criticism to stop breastfeeding at 12 months? So let's talk about how long, speak to that a little bit, maybe. Tiana, do you want to start?
Yeah, that's a real good question. Well, according to World Health Organization, technically, we're supposed to be breastfeeding for 2 years. And people go, oh my goodness, I can't do that. And of course, they're thinking newborn nursing habits, every time there are feeding cues, they're only nursing, only getting that breast milk. So nursing a 16-month-old, as Talita, said, is much different than a newborn. And so there are these wonderful health benefits for both the child and mother throughout your nursing journey. We encourage long-term breastfeeding to be able to get those health benefits and to keep adding that extra layer of protection from those antibodies from breastfeeding. However, we celebrate any amount of breastfeeding. It's important to do that. That's a start that they maybe perhaps wouldn't do. But we find with, once again, education and support, that sometimes like our moms, our sisters hold each other accountable. So you have a mom who comes in before birth and they get to have the education and they meet some other people and we're all sharing our stories and our challenges. And so then they come back after birth and they're showing their baby and, we've started, yes, our breastfeeding journey. Oh, I think I'm just going to do it for a couple of weeks or a month. And then they come back after a month. And they're like, we're still going. And then next thing you know, they're like at 12 months and beyond. And you go, hey, did you say you were going to breastfeed just for a month? Lovingly, playing. But, it's a sisterhood, truly. And it almost holds us accountable. And so as a mother who breastfed children until they were 3, so this is through teething, which there is definitely education and support around getting through that. Walking around, there are certain rules to this. Breastfeeding actually helps with certain, for you to build your relationship with your children and what you will allow and not allow. And so one of my things was I was not going to be having my children run up to me, lifting my shirt up, exposing me who knows where, to breastfeed. And so we had cues with each other. And they tapped my knee. And I would either say, get them together because I could, or I would say, mommy needs a moment. And they would respect that. So in that, we have this relationship of listening to me. There's something you need from me. I can't give it to you right now. Give me a moment. So now they're building patience. See what I'm saying? And so we still have my children are older now. And I still say, mommy needs a minute. And they know to respect that, Yeah. And I'm hoping that started from there. So when family, and I know it can be tough, not all my family was supportive. It was mostly their father's side. Sometimes you have to have a little bit of a tougher skin. It is nice if you have either your partner with you or someone who can kind of protect you from some of that. or you have invited some of those family to come to a support group with you so that they can also know and maybe even become your protection with more education. But at the end of the day, you have to try your best to strengthen yourself and empower yourself with the education that you know that why you're doing this for the length of time that you're doing this, and no, you're not nursing an adult, and you're not, all those little things, those silly things in which they say. You are enjoying your breastfeeding journey with your child. It's your business, and you are trying to make sure that their grandchild is getting the best nourishment they can for the best start in their life, so that they can grow up and be healthy.
Oh, thank you, Tiana. We're at our limit of time, so I'm going to let you close with that. And Dr. Stiles, do you have one last 5 seconds of something you want to leave? And then Talita.
I was just thinking about Haiti just then. I mean, what if you had a 15-month-old and you had that kind of disaster, that earthquake, but you were nursing, so your baby would get healthy, well, non-contaminated, milk, because you just happen to still be, breastfeeding. I just wanted to throw that out there. It's disaster preparedness. It doesn't require potentially contaminated water to mix. It's always ready and available, and so, yes, but it is a personal decision, and it's your journey and your decision.
Talita, what would you like to leave us with?
I guess I would just back that up. I think if you're pregnant or you're on your breastfeeding journey right now, seek and get the support that you, capital Y-O-U, needs, no matter what, others have an opinion on. I mean, this is a mutual relationship between you and your baby. And as long as one or both of you wants to continue, that's just that. And people can be, have whatever opinions they want. I think, especially if this is a question for someone breastfeeding right this second, right? COVID is like really all that you need to say, just in terms of, immunity. But yeah, surround yourself with the people, who are going to be truly supportive in what you envision for yourself and your family.
Could I say a word about COVID? I'm sorry.
Sure.
I should have ended with that. You're right. That's much better. But, in terms of it has been determined that it's totally safe and important for you to get your COVID vaccine, even if you're pregnant. And so the vaccine in pregnancy, as well as breastfeeding after pregnancy, whether you've had the disease or the vaccine, is all good. And so all the medical organizations have said, yes, those are important. I just want to throw that out there.
Thank you. Thank you very much. And thank you again to our panelists, Dr. Allison Stiles, Tiana Pyles from BSTARS, and Talita Oseguera from Choices. You have been awesome. Thank you so much. Thank you to all of our participants for your time. Do keep in mind that we will have a recording of this webinar, and we will post it out on Choices social media. So if you'll watch for Choices Facebook page, you'll see it there. And share this, because we did have a comment just now. I've been breastfeeding for 5 months and it's been a struggle every step of the way. And so I think the more that we can support each other and have resources out there that people can draw on, and hopefully this webinar will be one of them. Everybody have a lovely rest of your Friday and a lovely weekend. And thanks for joining us.